Hello everybody, welcome back to my follow-up video here. Just to recap, I saw this patient a couple months ago. I think it was early March or late February. She's 76. She came in with decreased hearing over the past week and oral fullness, but she didn't have any drainage, any pain. She didn't have any new tinnitus perception, and then she denied any dizziness or imbalance issues. So that day we cleaned her hearing aids, we replaced the filters, domes, retention lines, gave them a whole cleaning, brushed out the microphones, and they sounded good, so we were trying to figure out what was going on, and that's where my questions came from here. So my first question was, who was she referred to? Because we had seen her otoscopy did not look normal. Her canal looked very, very swollen, and you couldn't see the TMs at all. So everybody guessed it correctly. She was referred to ENT. This one was kind of a trick question because I am placed in an ENT clinic. So I just sent her down the hall like 2 minutes after I saw her. The pathology was otitis externa, which is what everybody guessed as well. This is chronic otitis externa. The physician that saw her said that she's likely had this since childhood. If you remember, the patient said that she experienced neglect as a child as well. So it was just chronic otitis externa that was never treated well, so it never went away. So sometimes it flares up more than other times. So the physician did clean out the ear and then gave her some drops to try. Honestly, though, she wasn't expecting a complete turnaround for her canals to look normal after trying the drops, but hopefully it would relieve some of the fullness that she was experiencing. When I looked in, it looked inflamed. The ENT said it's actually not inflamed. When she put a tool up to it, like a curette up to it, it was actually hardened, so the skin has just built up over time. So it's kind of interesting, and that kind of leads into what happened at her follow-up appointment with us. My last question was, what are the expected outcomes? And everybody said, hopefully after she's treated, things clear up and she gets back to where she was before. This bottom question here, or this bottom response, was from Zoe. And she said hopefully she finds some relief from her decreased hearing, but if not, after recovery, do another audio and adjusting as needed. And that's exactly what happened. So when she first got hearing aids, this was her audiogram. She was fit with Oticon Open S2 RICs with closed domes and 60 gain receivers, which I think is all appropriate. This is an audio from 2014, 2019, 2020, and 2021, so pretty much stable the whole time. So she came back after seeing the ENT. She came back about a month later, and she was still having issues. This time she said, I still can't hear well in the left ear. So we decided to do another audiogram. She had been tested in October of 2021, and then we tested her in March of 2022. So really not that far after, but if you can see, her right ear was totally stable, and she did have a significant decrease in the left ear, which we weren't expecting because we had only tested her about 6 months ago. So we went ahead and updated the audiogram in the software and recalculated the fit and the fine-tuning. We changed the receivers from 60 gain to the 85 gain Oticon receivers, and the closed domes were changed to power domes that fit her ear canal better. And then we completed new feedback tests and real ear measurements, and following that, the patient noted improvement immediately, which was very exciting to see. And she's doing well. Now she's going to start following up routinely, and we'll do at least one audiogram a year, if not more, if we need to. So overall, it turned out well. She does still have that chronic otitis externa, but that's never going to go away, and she knows that. So overall, everything is looking good. Thank you for watching.